The title of my talk today is Your Mirror Your Enemy? And we're going to talk today about the aging face, and we're going to learn about the latest cosmetic facial procedures that can be done to help you. I have a no gimmick rule here. Everything that I'm going to talk about I think is tried and true, and I think very effective. And those are the procedures that I like to do. We're going to start with talking about the aging face. We're going to start with talking about what happens to the face as we age and what we can do to improve that situation. So it's been shown for centuries and centuries ago, I think even the ancient Greeks measured the distances of the different aspects of the face. And in a youthful face, the distances are equal between the forehead, the midface, and the lower face are all exactly the same length. And yet with age, there's changes in those proportions. So if you look at any glamour magazine, any model, any actress, you will see that there's an equal distance for those three areas, and yet as we age, the hairline recedes, the forehead and the eyebrows come down, and the forehead lengthens. The midface also lengthens, the nose grows with every year that we live, and the cheeks descend. So the midface continues to grow in proportion, all at the expense of the lower face, which loses volume because of bone resorption, and a lot of the tissues go from the chin and the cheek and descend into the neck. So we're going to talk about all three areas and how we try to restore a youthful proportion to these three areas. So we're going to start talking about eyebrows and the art of the arch. I learned long ago that modification of the eyebrow is the very earliest thing that young females do to alter their appearance. And even though what's considered to be an attractive eyebrow has changed over the years, and maybe not everyone considered Greta Garbo's very, very high arched eyebrows in the 1930s to be attractive today, nevertheless, a youthful, attractive female has high arched brows, usually sloping outward to the temporal third where it reaches its greatest arch. And yet there are gender differences. Men can get by with lower eyebrows. It's considered rugged, it's considered attractive, it's considered masculine to have lower eyebrows, but as long as you don't have skin on the upper eyelids, as long as you don't have a lot of creases in your forehead, then that's considered to be attractive. And as we can see, males take care for their eyebrows as well. So this is a gentleman who came to me, probably only because his wife insisted that he come, because she didn't feel safe when he was driving anymore, because his upper eyelids were interfering with his vision. And I said to him, yes, we can do surgery on your upper eyelids, but your forehead and your eyebrows have come down. And so unconsciously, the brain is causing the brows to try to elevate, to try to lift the skin off of the eyes so that he could see. So that causes the deep furrows in his forehead, horizontal and vertical, and makes him look angry. And I said, you really ought to consider having a forehead lift at the same time, because the forehead, the upper eyelids are connected, and that you would look much, much better, less angry if you considered a forehead lift. So I tell all of my patients that the purpose of a forehead lift is not to bring your eyebrows sky high and make you look like the Joker in the old Batman series. It's rather to gently and naturally lift the brows a little bit and to relieve the deep creases that are in the forehead. And of course, there's a little bit different goal in a female, because in a female we truly are going for a little bit more arch and a little bit more elevation. So, so if you look before on the left, you'll see that she has skin on the upper eyelids, she has low-lying brows, and she has the deep creases in the forehead, and how much better she looks after the forehead procedure. Some people call a forehead lift an upper facelift. I don't really like that term, but you can see what a tremendous difference a forehead lift can make in terms of improving a person's appearance. Now again, this is the second male that I'm showing. That's not a coincidence, because of all the procedures, men have eyelid surgery and they have forehead lifts, almost in equal numbers to women. That's not true of other procedures. So lots and lots of men are having this procedure done, and you can see what an improvement it makes in his overall appearance and in facial rejuvenation with a forehead lift procedure. Here's, again, another male. And here he is on the lower left, and you can see he's got skin on his upper eyelids. You can see that his eyebrows don't look so droopy because his forehead is contracting all the time to try to elevate his brows. Not that he's ever aware of it, it's just something that happens. So he elected to proceed with a forehead lift, a small incision forehead lift, and his postoperative view is on the right side of the slide. And how much better he looks, more alert, and relief of the crinkling of the forehead and smoothing of the forehead creases. The reason I showed the middle slide is that obviously for women it's not really an issue most of the time, but for men, some men are balding, and I like to refer to them as follicularly challenged, like myself. So, so I use 5 small incisions. Each one is a 1/2 inch to 3/4 of an inch in size. 2 of them are in the temples where even follicularly challenged males like myself have hair. But in the frontal area, those 3 incisions heal extremely well, even in a balding male, such as this gentleman. So even though you're looking directly at those incisions, you really can't see them. So that's my way to do a forehead lift. There are other ways to do it, but this is the procedure of choice, I think. So now we're going to talk about the midface. The midface goes from the area between the eyebrows to the deep line that runs from the corner of the nose to the corner of the lip. That's called the nasolabial fold. And as we age, that area descends and the cheeks descend, and they deflate. And also you can get fluid-filled bags on the cheeks called festoons. The midface is a very hot topic in facial rejuvenation right now. The idea is I can go to seminars and they can have whole days discussing the midface with different techniques. But the idea is to shorten the distance from the cheek prominence to the lower eyelid by lifting this area and by adding volume to augment the cheek. So I'm going to digress a little bit, and I say that there's 3 aspects to facial rejuvenation. One is to combat the ravages of gravity, and these are the 3 things, these are the areas of the face that we're talking about, and we're going to correct that with surgery. The other is to improve the way your skin looks, because the tone and blemishes and pigmentation can age you. And then the third is that with age we lose facial volume. So if you really want to rejuvenate a face, you need to add volume. And no place is this more important than adding volume in the cheek, because a youthful face is a full cheek, a rounded cheek, and that's part of what gives people a glow. So part of the mid-face lift is adding volume to the cheek. It restores a youthful appearance to the cheek, and it decreases the depth of the nasolabial fold. And we also eliminate the excess tissues and fluid-filled bags that are on the cheeks, which are called festoons. Now, when you evaluate the before and afters on the mid-face, I will tell you that these slides are 2-dimensional. You can't get a full appreciation unless you learn to think in 3 dimensions. But again, she's preoperative on the left, after the mid-face lift on the right. So beforehand, you can see how sallow her cheeks are, how they've fallen, and there's no volume to the cheek, and they even have deep lines that run below the lower eyelids. You have deep nasolabial folds. And then after the surgery, you can see that the cheeks, first of all, we've shortened the distance between the cheek prominence and the lower eyelid. We've added volume to the cheek, and we've relieved the depth of the nasolabial fold. And this is more impressive in person than it would be in 2 dimensions. Again, similar, you shorten the distance between the cheek and the lower eyelid. We relieve the depth of the nasolabial fold. We add fullness to the cheek. The festoon, this lady had very prominent festoons. You can see them on the upper left slide, but even more on the lower left slide, it's that deep line that runs down and to the right, and that is not a bag in the lower eyelid. That's a deep fluid-filled bag in the cheek. So you're just not going to get that with eyelid surgery. You have to go to the midface in order to lift the midface and remove the excess tissues and fluid that are involved in the festoon. But I think we would agree that she looks so much better after the procedure than before, and she was not an old person. This is a much more subtle case, a younger patient. But again, we've added volume to the cheek, we've shortened the distance between the cheek and the lower eyelid, and we took away the small festoon that she was manifesting on the cheek, and how much better she looks after the procedure. And another patient, again, showing perhaps in between the last two cases. In the lower left, you can get an idea of the festoon that we're talking about. A lot of times, that's what bothers people the most, the festoon. And it's a fluid-filled bag, and you don't get that with a facelift, and you don't get that with lower eyelid surgery. And the only way to get that is with a mid-facelift procedure, which we frequently combine with lower eyelid surgery. But after the surgery, she has much more volume to the cheek, and the cheek is more continuous with the lower eyelid. So now we're going to talk about a facelift procedure. Now, some people use the term complete facelift. I really refer to a facelift procedure affecting the lower third of the face and the neck. Usually we include a neck lift with a facelift procedure. So a youthful face is like in A in this slide, and you have a discrete sharp angle between the mandible and the neck. And yet, as we age, we begin to show changes, as in B, the early changes. You see a little bit of the nasolabial fold. You see a little bit of the marionette line. She's getting some crinkling in the neck, a little bit of banding. This progresses to C, and of course gets even worse in D. And by the time you get to D, you have these deep, dense jowls, and you have all this sagging in the neck that we refer to as a turkey gobbler neck. So, so the facelift, the way I use the term, refers to the lower face, and it is not just a procedure for females. Men have this procedure done as well, and people who want a facelift come in all age groups, obviously different genders. Here's a gentleman who was still working. He felt that his appearance put him at a disadvantage to compete with other men that he was competing with, and that's why he had the procedure done. And as I said, people come in different genders, but they also come in different age groups. So this lady is only 51 years old, and she's a good example of people ask me all the time, how long does it take to heal from any procedure? And the answer is that there's no short answer to that, because healing is a process. So this lady is only at 9 days after surgery, and she had upper and lower eyelids done, and she had a lower facelift done. And she is wearing her hair over the incisions. So the incisions are made in front and behind the ear. But at 9 days, she had absolutely no bruising in her neck or in her jawline. And the only clue that this lady had surgery 9 days ago is that she has a little bruise in her left lower eyelid, which I'm going to show pictures of that later. So healing is a process. It depends on people's general health. It depends on gender. It depends on blood pressure. It depends on whether you're taking vitamins or anticoagulants. Last patient was 51. This patient was only 44. And she was unhappy with the jowl, and she was unhappy with the banding in the neck, and so she wanted to have something done. So some people might ask me, what is the right age to have something like this done? And the answer is there's no short answer to that. There's no problem doing something if you're in your 30s or in your 40s, because you get a lot of years of enjoyment out of it, and if it bothers you and you want to have it done, I see no reason why not. Likewise, for the older patient, if patient's 70s, if patient's 80s, and they want to do something to improve their appearance, then why shouldn't they, as long as they're healthy enough to have the procedure? again, this patient's in her late 60s, I would say, and you can see what an improvement she's had to her face and to her neck as a result of having a lifting procedure. And this has taken many, many years off of her appearance. She was extremely happy, and it's a good example of what can be achieved with surgery. Patient in the 50s, you can see the early banding in the neck and how much better she looks after the procedure. And another patient in the 50s. And you know, this particular patient was extremely pleased with her appearance. I would say that she lost at least 10 or 15 years. People would say she was about 10 or 15 years younger than her age for having this procedure done. So she was an extremely happy person. It was very gratifying to me to take care of. And I think that's why I do what I do, and it's why I enjoy doing what I do. This is a patient that I think was 54. You may look at her and decide she really doesn't need anything done. And that's fine, but she thought that she needed something done. So she has a little bit of banding in the neck, a little bit of jowls, and so we tightened that up for her, and her jawline and her neck are almost like that of a 20-year-old. And so we like to say that they're almost smooth as a baby's bottom, and she was extremely happy with that result. So that's discussing the different ways we restore the proportion of the aging face to a more youthful proportion, the 1:1:1 that we discussed earlier. So now I'm going to talk about other procedures, that some of which are non-surgical, some of which are lunchtime procedures. You may hear that term. And we'll discuss injections as well. Chemical peels. I'm a big fan of chemical peels, but a peel is not a peel is not a peel. There's well over 100 different types of chemical peels. I probably offer 10 or 20 different types in my office. Chemical peels have been around for a very long time. If you go back to ancient Egypt, the women used to, give hints to themselves that if they bathed in sour milk, it would give you a more youthful appearance. And of course, sour milk has lactic acid, and it would freshen the face and make the women more attractive. This is one type of peel that I use. This is an Obagi blue peel. Obagi is a dermatologist in California. These slides are from him. I don't have many patients that ask only to have one half of their face done. So presumably this person worked for Dr. Obagi. So you can see her on the left, and you can get an idea of what she looked like. So somehow he convinced her to only do one half of the face for purposes of illustration. And here she, and it's not such a great photograph, but I think you can appreciate that on the left side of the screen, her right side of the face is a little bit more shiny, and the skin looks just younger and healthier and prettier than the other side. Again, another one of his patients. This is a patient with acne scarring, and we will talk more about acne scarring in a few minutes. But here she is at the time of her blue peel procedure. She has a diffuse, an even blue peel. And so you can tell already she's going to have a good result from this procedure. And so here she is after the procedure. Again, the blue peel is only one of the procedures I offer. We offer even lighter peels than that. We offer salicylic acid peels. We offer Jesner's peels. We offer glycolic peels. But there's many, many different types. But bar none, my favorite peel is a Heder facial resurfacing peel. Gregory Heder was a plastic surgeon who has actually retired to Florida. But he came up with a peeling solution, and he gave for the first time, he gave these deep peels a way to modify the strength so that you could apply different strengths of the peel to different areas of the face. So you can modify it so in certain areas you go deeper than in others, and you also modify it to the particular patient. So I like to think of it as very analogous to laser facial resurfacing that we will discuss later, but I like the Heder resurfacing procedure even better. This lady is only 51 years old. She was in the sun a lot, and you can see the deep, deep creases and lines that are above her lip. And we used to call those smokers' lines, but we know now that we see them in non-smokers as well. The beauty about a header resurfacing procedure is that, and there aren't too many things I will say this about, but the results from that procedure are permanent. And it's truly almost a miraculous procedure. If you take a look at this lady, maybe she's 70, before and after, we did the header resurfacing at the time of a facelift. She had a great result from the facelift, but without a doubt, I think it was this improvement that really, really resulted in tremendous facial rejuvenation for her. I've seen other patients where other doctors are giving Botox to these lines, which I absolutely don't agree with. I see other doctors put fillers in these lines, which is okay, but not fantastic. But there's no better procedure than this for this kind of problem. Again, a younger patient that I showed earlier, and so we can modify the strength of the peel. This patient does not need the same strength as the previous patient, but nonetheless, you can see a tremendous improvement in rosacea, tremendous improvement in uneven pigmentation, a tremendous improvement in age spots that she has as a result of the resurfacing that we did for her. Again, a patient with deep acne scarring. This is before and after. And afterwards, if you're thinking in the audience, does she still have acne scars? Yes, she still has acne scars. I agree with you. And there's a few more things that I would have liked to do with her. But nevertheless, she looked so much better as a result of the header resurfacing alone that she didn't choose to have anything else done. She was sufficiently pleased, and I was pleased with her results, but I think we could have gotten even a little better if she had wanted. Again, another patient, you can see the deep lines both below the lower lip, above the upper lip, and the face is resurfaced. Again, the results are permanent. You have a permanent improvement, not just in the way the skin looks, but in the quality and the texture of the skin as a new skin forms to take the place of the old diseased skin. And you have new collagen formation, and that's what takes away the deep wrinkles. Okay, so now we talk about acne. The medical term for acne is acne vulgaris. We think of it as a disease that affects teenagers. It doesn't just affect teenagers, but it does affect just about all teenagers. They say about 80% of all teenagers develop acne. That's across the world. That's everywhere, whether we're talking black skin in Africa or Asian skin or whatever. Some people just have a few pimples, whereas others can have hundreds of pimples on the face, neck, chest, and back. The problem is that while we think of it as a disease of teenagers, it continues to affect people in later age groups, particularly women in their 20s, 30s, and 40s, and associated with the menstrual cycle. While we need to treat the acute outbreaks, because what you don't want is the outbreaks to develop into acne scars, which is really the dreaded complication of this disease. I think anyone in this room would be hard-pressed to find any disease that causes more psychic trauma, general insecurity, and feelings of inferiority than acne does. So this is how we treat acute acne. Obviously, we use soap and warm water. Benzoyl peroxide is a topical agent. Salicylic acid, they have salicylic acid soap. We can do salicylic acid peels. Then, of course, there's topical antibiotics, and there's topical retinoids like Retin-A. And any of the first four are extremely successful in relieving the problem. If it doesn't relieve the problem, then we get more aggressive. And the bottom line is where you begin to get into problems. Oral antibiotics are fine. We use them all the time for a week or so. But if you have severe acne, you don't want to be on oral antibiotics forever. It can cause side effects. And nothing is more true about side effects than Accutane. Accutane is a systemic retinoid. We take it by mouth. It absolutely dries up sebaceous secretions. It absolutely is helpful in the treatment of this disease. However, it's very controversial, and people talk about whether it may cause psychological disturbances, depression, psychosis, and there's court cases that abound. So if we can avoid long-term antibiotics, long-term Accutane, that's in everyone's best interest. This disease is so prevalent, we spend $5 billion a year on medication to treat it. And so better than long-term antibiotics, better than Accutane, I think, is using laser to treat acne, laser phototherapy. It uses light and heat energy and is definitely beneficial in relieving acne outbreaks. And here's the kind of, that's a true lunchtime procedure. You come in, you have it done, and then no one knows that you had it done. It takes a few treatments, and it dries up sebaceous secretions, and that will then relieve the acute outbreaks of acne. The problem occurs when you get acne scars. That's a more complicated problem. And there's different types of acne scars. There's ice pick, boxcar, and rolling. In my opinion, each patient requires multiple types of treatment, and the patient and the physician must be willing to use a multimodality approach to address any individual needs. So some of the things that I do include head or facial resurfacing, laser phototherapy using laser and heat energy, fillers to bring out the deep scars, subcision. What that means in English is that you cut below the scar in order to elevate the scar to the surface, and punch excisions where you remove the scar. So every day I go on the websites that are the cosmetic surgery websites, and every day someone's asking, what's the best laser to treat acne scarring? And in my opinion, it's not a question of which laser is best, but really in choosing a physician who's willing to use multiple modalities to achieve the best results. It takes patience. The doctor has to be patient. The patient has to be patient. But there can be a tremendous improvement in this problem. So this is the kind of results we want to see. And this is deep acne scarring, and what a great improvement can be achieved if the patient is willing to be patient and go through the steps necessary. Again, this lady felt so much better about herself after treatment than before, and that's what makes the whole thing worthwhile as far as what I do. It's very gratifying to see the improvement we can bring to people. Okay, so now we're going to switch gears and talk about Botox. Botox is sort of an old and dear friend to me. It's only been approved, we tend to forget this, but this month makes 10 years since it was approved for cosmetic application. I've been using Botox since the mid-1980s. We forget, people don't want to attribute it to, but it was invented by an ophthalmologist in San Francisco. He was using it to treat eye muscle problems, and then later we used it to treat movement disorders. So I was using Botox when it was still investigational. 10 years ago, it became approved for cosmetic use. Dysport is a newer cousin of Botox. The beauty about Allergan 10 years ago was they applied for a cosmetic application, and they applied for it to treat between the eyebrows. And we can treat the deep furrows between the eyebrows. The beauty of that is, and we were using it for 10 years for that, or 15 years, or 20 years, we were using it for that. But then they applied for the cosmetic application, and once they got that, they could market it to you, okay? So no longer were they marketing it to us, they were marketing it to you. And that brought about an explosion in use for Botox. And everybody gets Botox, even your friends and neighbors, even if they tell you or don't tell you, okay, they are getting Botox, okay? Men get it, women get it, everybody gets it, okay? So, so it really is a great drug. It treats the lines between the brows, but we use it elsewhere. We use it to treat other lines in the forehead. We also use it to treat the crow's feet. And of course, most recently, they decided that they could use it to relieve migraines in certain patients. And that's also a very gratifying thing when we relieve chronic headaches. I guess I like Dysport a little bit better in the crow's feet. These two agents are very alike. Botox and Dysport lasts about 2 to 6 months. And it's something that it's a true lunchtime procedure. You can come in, you have it done, you go right back to work, nobody knows you did it, your husband doesn't have to know that you did it, okay, it's just between your doctor and you, okay, and it makes a big difference. It takes away the anger, you know, the creases in the forehead, and stops you from looking angry. So similar to Botox, but different than Botox, are fillers. Botox and Dysport work by paralyzing the muscle. And what that means is the wrinkles that are caused by facial expression, that's what you treat with Botox and Dysport. Fillers are different. You're treating static wrinkles with fillers. There are 120 fillers on the market. I remember, because I'm old, when there was just collagen, okay? And they've made such improvements in fillers, but despite the fact that there's 120 of them, they're much more alike than they are dissimilar. A filler fills out a wrinkle. That's what it does. And so even though there are so many, that's what fillers do. Again, it's a lunchtime procedure. You can come in, you can have it done, and probably you go back to work and nobody can tell that you had something done. There's lots of types of fillers. Without question, Restylane and Juvederm are the most popular fillers. They're much more alike, again, as I said, than dissimilar. They're actually made of exactly the same stuff. They're made by 2 different companies. So the companies want you to ask for Restylane, they want you to ask for Juvederm. They're pretty much the same thing. They last 6 to 12 months. Radius is something different. Radius lasts longer. I really like Radius in the nasolabial folds. It's not right for lip augmentation. Sculpture is a little bit different still. I think that it's a great filler to add overall facial volume, like I was talking before. Part of what happens with age is that we lose facial volume, so Sculpture can replace it. Fat, of course, is autologous. Obviously, it has the theoretical advantage that you get improvement in the donor side in addition to where we put it. But you're not taking that much, so it's not exactly the same as total body liposuction. It tends to be more expensive because it's an actual surgical procedure. So you're harvesting fat from one area, you spin it down, and then you transfer it to different syringes, and you do a micro droplet technique. And I think it has its best application for overall adding volume to the face. But it's not permanent. It probably lasts 2 to 3 years. The problem is there's a lot of swelling with it, and it's a little bit unpredictable as far as how much of the fat is going to survive. And finally, there's Silicon 1000, which is made by a medical company called Alcon. It is not approved as a filler. That doesn't mean doctors can't use it as a filler. And I think about 40% of doctors use it as a filler, and I'm one of that 40%, and I love Silicon 1000. I think it's fabulous. It is a permanent filler. So here's a lady who has beautiful lips to start with. She didn't want anything done with her lips, but she didn't like her nasolabial folds. So with just one syringe of Radius to her nasolabial fold, you can see, now we can look at this relatively young person and say, there's not that much wrong with her nasolabial fold. And that's fine, but she thought there was something wrong with her nasolabial fold. So she comes in for this lunchtime procedure. We inject one single syringe of Radius, divided up between both sides, and all of a sudden her fold is much less deep, less prominent, less old looking, and she walks out that way. So it's a nice thing to be able to do for someone. So I would like to say that this is a patient that I did a filler on, because I'm talking about fillers. So certainly you could get this result with Restylane or with Juvederm. But this particular lady was 24, and she actually elected to go with lip implants. I used permafacial implant. If you look lower left, she's 24. She has pretty lips to begin with. I'm not saying she doesn't, okay? She wanted them to be augmented. So in the slide right, she has a more voluptuous looking lip, and lips, plural, and she felt that it was a tremendous improvement. And this is a very simple procedure to do. I've had tremendous success with these implants. It's quick, it's easy, and it gives you a permanent augmentation to the lip. Okay, we're going to switch gears and talk about eyelid surgery. So every single day, people ask me about eyelid surgery, particularly upper eyelid surgery. And what they want to know is, will my insurance cover my upper eyelid surgery? And I wish I could give you a short answer to that question. There is not a short answer to the question. There's a very long answer to the question. Essentially, if you had a lid like this gentleman, and you can see it's covering most of his eye, and you could argue that yes, the insurance should cover his eyelid surgery, and after the surgery, he sees better. He sees more of the world around you, and you and I are not as fearful about being to the side of him as we would when his lid was droopy, okay? But that doesn't mean, on the road is what I mean, but that doesn't mean that insurance will cover your eyelid surgery. Yes, it depends on your insurance. Yes, it depends on how droopy your eyelid is, but it also depends upon who reviews it for a particular insurance company. And it's, you know, people come in, they ask, just write a letter. Well, no one asks me my opinion anymore. Okay, they want to see photographs. They want to see documentation. So there's no short answer to this question, but whether insurance covers this or doesn't cover it, even still, an insurance case, when we're doing insurance to improve vision, is not the same as a cosmetic procedure. So there is a difference to the procedure. But just because insurance doesn't cover something doesn't mean that you shouldn't have it done. Although we're about to talk about eyelid surgery, if you look at this young woman, you can see what I mean about the equal proportions between the forehead, the midface, and the lower face. And that's what we see with youth. But getting back to eyelid surgery, easily it's the most common surgical procedure that men do. It's the second most common thing that ladies do. Without doubt, cosmetic eyelid surgery is the most delicate and demanding procedure that I do. Just 1 millimeter of extra skin taken, or conversely, 1 millimeter of extra skin left behind, can make a huge difference in the outcome for the patient. So I think that oculofacial surgeons are the best and most experienced surgeon for this particular procedure. So when you consider having eyelid surgery, you may want to be careful. I wouldn't necessarily choose the person that has the largest office, the nicest waiting room, the prettiest receptionist, or whether they serve coffee and cake in the waiting room. Okay? It's very important to choose experience. So I would suggest don't go to just anyone for cosmetic eyelid surgery. So I've already implied that this is almost done equally between the genders, and yet the next slides I'm going to show just refer to women. That's the luck of the draw. But the purpose of the next few slides is to show that people of all ages have this done. This is a lady that was only about 35, and yet she was very bothered by her upper eyelid, and she was very bothered by her lower eyelid as well. And so the same patient, with the side view, you can get an even better idea of how much the skin on the upper eyelid was touching her eyelashes. She had no place to put eyeshadow. So, and then of course she had the bagginess, sort of bags in the lower eyelids, heaviness, and so how much more youthful she looks as a result of her eyelid surgery. So this is a patient only 35 years old. Does that mean that only 35-year-olds should have it? And the answer is no. This is a patient late 70s, early 80s. And you can see she wanted to have upper eyelid surgery. Maybe she wanted to have it to see better, but she really wanted to have it to look better too, okay, because she wanted to have her lower eyelids done. And so if we do a close-up view of her, you can see what a difference the eyelid surgery makes, how much more alert she is after surgery, how much more young appearing she is after surgery. And in fact, perhaps if people were to do one thing, there's an argument that if you can do just one thing, you should do eyelid surgery. Because when we talk to people, when we greet them, what do? We look at people's eyes. We don't always look down and see whether their neck's sagging, but we always make eye contact with people. So certainly the way the eyes look is of critical importance, and how much younger she looks after her upper and lower eyelid lifts. And then here's a patient that's sort of in the mid-age group having upper and lower lid surgery. And again, how much more alert she looks and refreshed she looks from having the procedure. I would say eyelid surgery lasts longer than facelift surgery or forehead surgery, and I think you get 15 to 20 years out of it. Again, this is the lady that we showed earlier. I just want to show her eyelids. So here she is after upper and lower, and this is a little bruise that I showed you in the left lower eyelid, and that's going to be gone. She's about day 9 right now. An S-lift, by the way, is a small facelift, small incision facelift, and so that bruise will be gone in another 2 or 3 days, and she'll be good to go. So here's a patient that came to me with bags in the lower eyelids. She also wanted her upper eyelids done, but I noticed a ptosis in her right upper eyelid. That's the eye most to the left on this slide. And you can see that's due to a weak muscle in the eyelid. So someone like myself, an oculofacial surgeon, can notice it and can fix it. And that's just not something that any general plastic surgeon will do for you. They just don't have the training. So this is a patient where we combined bilateral upper and lower eyelid surgery or blepharoplasty with ptosis repair just in the right upper eyelid. We took away her bags. We also improved her symmetry. Again, combination procedures. This is a patient that had ptosis repair, upper and lower lid surgery, mid-face lifts, and full face header resurfacing. So the final medical topic that I'm going to talk about today is laser resurfacing. The original laser was developed in the mid-1990s. It was a CO2 laser. Then they came out with an erbium laser, and now they're using fractionated CO2 lasers, called one of which is the Fraxel. But all of these lasers remove the outer layers of skin, then the skin heals from underneath, and it takes away wrinkles. So, and it improves skin quality and skin health. So these are the kind of results that you can see with laser resurfacing. I do not say that this is a non-surgical treatment. I say it's a non-incisional treatment. There's no incisions necessary to produce this kind of result. Again, this is a lady that could have had a lift procedure, but she elected to have laser resurfacing, and what an improvement it made in her skin and in her overall facial appearance. So that's the sum total of my talk today. And I know everyone wants to know how much things cost, okay? And if I was sitting in the audience, I would want to know how much things cost. So I'm going to discuss how much things cost, okay? So before we decide that this thing is ridiculously expensive, he's crazy, okay, we have to decide and look at how long things last, okay? So Botox is 2 to 6 months, fillers are 6 to 24, and one is permanent. Again, I'm a big fan of Silicon 1000. Forehead lifts last 10 years, facelifts last 10 years, eyelid surgery 15 to 20, and I think header resurfacing is permanent. And of course, when I say it lasts 10 years, even when 10 years have elapsed, you're still looking better 10 years later than had you not had the procedure done. How do we pay for these things? Well, we do take cash, okay? We do take checks, okay? But yes, you can charge it on a credit card. We do have Care Credit, which is a financing option, and there are even other financing options available. So what you want to do is you want to divide the cost by the length of time you enjoy the benefits, and then hopefully you may think that the procedure is not that expensive. But the next slide is the one that we're all waiting for. That's how much things cost in the Tampa Bay area. It gives you a general idea. Obviously, for something like Botox, it depends how much Botox you use, okay? Some of the surgical procedures, it depends what type of anesthesia you're doing. It depends whether the procedure is done in the office, in the surgery center, in the hospital. Everything that we do is outpatient. Nobody's staying overnight in the hospital. If I was having it done, I wouldn't want to stay overnight in the hospital. And for the most part, none of these procedures hurt. Okay, you have to heal, but it is not painful. People ask me, are they painful? The answer is no, these procedures are not painful. So that discussed costs, and that concludes my talk today. Thank you.